Well, good morning to our audience and welcome to this webinar, the first of 2025, run by Wellbeing of Women. My name's Lesley Regan and I'm the chair of Wellbeing of Women, which is a great privilege. I'm also an obstetrician and gynecologist and the Women's Health Ambassador for England. And we thought we would start off 2025 with a top tips session. And to help me achieve this, I've got four fabulous panellists with me who I'm going to introduce you to in a moment. And they're going to cover lots of different aspects of health and wellness, such as eating well, keeping active, pelvic floor health, screening and health checks, sexual health, posture. It just, there's nothing that they're not going to be able to help us with. And I think we're even going to have a demonstration. So prepare yourselves for a bit of popping up and down, or perhaps doing your pelvic floor exercises on your seat or whatever. The session is going to be recorded, and we'd like you to please, in the audience, use the chat function for comments about the webinar and also your questions. And what I'm going to do in a moment, when I've introduced everybody, is ask each of my four fabulous panelists to speak for about 5 minutes each. And I reckon that'll get us to somewhere near about 12:30. And then we're going to reserve the whole last half an hour for the audience questions. And indeed, we may have some of the panelists and me asking questions of this wonderful team. So I'm really, really looking forward to this. And as I say, we're going to record it, and please use the chat function if you'd like to ask questions. What we usually do is collate all the chat, and if there are questions on the chat that we haven't had the time to cover, then the very helpful Wellbeing of Women headquarters team usually try and get answers to those and then circulate it to anybody who's registered to come to this webinar. So before I introduce them, I think, ladies, you have, my four panelists, you've actually attracted lots and lots of interest. We've had an enormous number of registrations, over 700. We had to actually get a bigger, platform in order to host everybody. So that's obviously very good. So hopefully all the women in our world at the moment are looking forward to 2025 and perhaps turning over a new leaf. Perhaps they're going to share with us some of the New Year resolutions that they've chosen. So let me start to introduce you. So Dr. Philippa Kaye. Philippa, can you just wave at us just for a moment so everyone can see you? Lovely. So Philippa Kaye is a general practitioner and she's got a particular interest in women's health. And she, I know, because I've worked with her before, is particularly interested in screening programs for gynecological and reproductive health and sexual health. But she isn't going to be limited by that. She knows that my is that she can touch on other areas if she would like to. And then I'm going to ask Laura Clark to speak, and there's Laura up there, because I'm not going to say where she is on the screen because it might be different on your screens. And Laura is going to is a registered dietitian, and she's a food therapist and nutrition consultant, and she's got masses and masses of experience and really has a very sensible, down-to-earth approach to help her clients make meaningful changes to support their health and achieve their well-being. So she's particularly interested in scientific research and the complexity of nutrition, which it certainly is. I mean, I can't open a newspaper these days or a magazine without someone telling me that this is a superfood or an antioxidant or this is going to make my eyesight better or whatever. So she's going to, I think, help us go through all that maze of stuff. And then I'm going to move on to Jane Wake. And Jane is a top fitness professional. She's got a particular interest in women's health. And she has a degree in sports science and Pilates and personal training. So she's just the sort of person that we need to have here. And one of the audience has said, I can only see Lesley on the screen. I can see 5 people on my screen. So I'm just letting the headquarters team know that there may be a problem there. And Jane has done, in addition to all of the work that she's done in sports science, she's also written several books and developed resources and DVDs which were approved by the Royal College of Midwives, which is also very helpful. And then last but not least, we have Nadia Alibi, who is an osteopath of Back to Wellbeing. And I think it's a very good title, that Back to Wellbeing, a multidisciplinary healthcare clinic in London. And she's got much experience And in the run-up to introducing all these panelists to you, I understood from Nadia that osteopaths don't just deal with bones, so that was my ignorance. They also deal with muscle groups and posture and all sorts of other fabulous things. So Nadia has contributed to many health-related articles, and she's been regularly published in The Guardian, Daily Mail and Vogue. And also interested in the joint pain clinic segment of This Morning. So without any further ado, I think I'm going to now introduce or ask Philippa to tell us a little bit about herself and also what she wants to bring to this webinar. Philippa, over to you.
Afternoon, everybody. For everybody asking about the fact that they could only see Lesley, that was probably because she was speaking. So hopefully now you can only see me. That might be how it is set up. So hopefully you can now see who is speaking. So my name's Dr Philippa Kaye. I'm a GP. I have a particular interest in women, children's and sexual health. And you might have seen me on the television or heard me on the radio. And part of my job as a media doctor is what I call translating medicalese into English, because it's no good me and Lesley having a conversation in medicalese. Everybody needs to understand what's going on. So we are talking today about women's health in general, and often at the beginning of the year, people make very specific New Year's resolutions and they forget the basics. And they talk about things like self-care. And when I think about self-care, I think about the flake advert, where it's a lady in a bubble bath enjoying a flake, right? By the time we're getting down to the flakes and bubble baths, we're tweaking sort of right at the edges. We need to start with the basics. And the basics are around things like nutrition and exercise and a roof over your head and people to talk to. And when it comes to women's health, actually often the basics aren't about being unwell, but about being well. We're not unwell when we want contraception. This is something Lesley says a lot. We're not unwell when we want contraception. We're not unwell when we're pregnant. We are just dealing with being a woman. So self-care when it comes to women's health, for me, starts with knowing you're normal. Aside from the screening programs, when I come to you and say you are invited to X, Y, and Z, we as doctors wait for you to come to us. And you can't come to us and say something is no longer normal if you don't know what your normal is. So that might be your normal menstrual cycle, the normal amount of days that you bleed for, the normal, how often you do a poo and what it looks like. You have to know your normals. And part of knowing your normals is around self-checks. So we recommend that you examine your breasts once a month. If you are still having periods, after your periods is a great time because they might be a bit more lumpy before your periods. And if you don't feel on the first, it's a great way to remember. We also recommend that you check your vulva. Now, when I go into schools and I talk to young kids and I talk about self-checks, when you say to the boys, you've got to examine yourself, the boys, they sit up and listen. And when you say to the girls, you need to check your vulva, there is often this gasp of horror that I have asked them to do such a thing as taking a mirror and a light and knowing what it is that you look like so that you can come and say to us that something has changed. And then we invite you for screening. Now, there is some screening which is specific to women's health, but there is also screening which is available to everybody. And screening actually starts whilst your mother was pregnant with you. So we have screening programs during pregnancy. We screen for infections, things like HIV. We screen for various conditions in the newborn. Are you a high risk of having a pregnancy with Down syndrome, for example? And then when you're just 5 days old, we do a heel prick test and we test for a whole variety of conditions in the newborn. And then we tend to leave you alone for a bit, unless you have a condition like diabetes where there are regular eye checks. And the first check that most women have that's part of the screening program that they remember is the cervical screening program. And that starts at age 25 and it runs until age 64. Now, where you live in the country will depend on how often you go. So in Scotland, it's every 5 years. In England and in Wales, it's every 3 years, 25 to 49, and then every 5 years, 50 to 64. The NHS has pledged to eradicate cervical cancer by 2040, and it will only do that that if we can do better at two things. And those two things are vaccination against HPV and cervical screening. And cervical screening attendance is only about 2/3 of women. Cervical screening picks up a virus called HPV that causes the vast majority of cases of cervical cancer. It actually has the power to stop you getting cervical cancer in the first place. Breast screening program starts at 50, and that's every 3 years, between 50 and 70. After 70, you are still eligible every 3 years. You just have to contact your local screening unit, as opposed to them inviting you. If you are at high risk of breast cancer, perhaps you know that you're a BRCA gene carrier or you have a very strong positive family history, go talk to your doctor. We might be able to get you into a high risk breast cancer screening program, which starts earlier. And then there are other screening programs which are for everybody. So for example, the bowel cancer screening program, which thankfully is finally being brought down to start at 50. And that's you have to send off a little sample of poo in the post. So there are lots of things that we're doing with the aim of either catching something before it starts or treating it at an earlier stage where it is less likely, where hopefully we'll be able to treat it and you'll be able to make a full recovery. And just 1 minute really briefly on sexual health screening. This is one where you need to come to us. Okay, so you need to come to us, and we recommend actually that if you are changing partners, that you come at least every 6 months, either to your local sexual health clinic, or lots of these tests are available online for free under the NHS, for example, websites such as SH24. And if you're changing partners extremely frequently, then we might recommend that you do that every 3 months. We have to remember that there are lots of sexually transmitted infections that might not have symptoms or might not have symptoms until much later. And you can still pass them during the stage where you might not know that you have symptoms. So there are things where we need you to come to us and things where we invite you. But either way, we have to know what our normal is so that we know when something changes.
Lovely. Thank you very much, Philippa. And your comments about screening and how we've got to go about encouraging women to know what is normal is so important. And I think it really resonates very much with the women's health strategy that I've been trying to help implement in my ambassador role. And then with our new government, who, as you know, came in last July, their 3 mantras for the NHS and for change in this next 10 years is to go from analog to digital, so to usually really utilize digital, and from go to hospital to community, and to go from treating illnesses to preventing illnesses. And I think that that very much fits in with what you've been describing to us. So thank you very much indeed. There'll be questions, I'm sure, coming up. But let me move over to Laura now. And she's going to tell us or give us some broad tips. Well, actually, I'm not going to tell you what you're going to say because you're going to tell us, aren't you? Over to you, Laura.
Thank you. Good afternoon, everybody. It's lovely to be with you this afternoon. Lesley described nutrition as a maze of stuff that we're trying to navigate through. We have a phrase in our industry which is a little bit sweary, but we call it nutribolics, because since I qualified 25 odd years ago, people came to me because they sought knowledge and I could provide that. And now I feel we have lots of knowledge at our fingertips, but everything contradicts everything else. And perhaps we think we're lacking motivation to make changes to make us feel healthier, when perhaps actually what we're lacking is clarity. I've got 5 minutes to give you some clarity, which feels a little bit pressurized, but I'm going to do my best. And to keep to time and give you the best I can, I want to just share a couple of slides with you because it just helps me to not waffle. I'm really passionate about nutrition and I'm really passionate about people and science, and I can get on my high horse very easily. So I want to keep on the ground with you for the next 4 minutes. I've used this circle of influence model that you probably are familiar with in other ways to illustrate a couple of points. And that is that we have a diet and wellness industry which is worth billions of pounds that will continue to peddle the idea that we absolutely have to put weight loss front and centre of our lives in order to achieve a healthy status. And what we categorically know is that weight loss itself is not a behaviour, and we cannot control our weight despite what we are led to believe. There are so many subconscious mechanisms at a physiological level, particularly as we go through the menopausal transition, that influence what our body weight does. And in all of the women that I work with, I see so often we feel like we're hamsters on a wheel, drowning in all this contradiction, trying to do the best by our health, but just feeling that we're a bit lost at every turn. Hence that beautiful phrase, maze, makes so much sense. So what I want to drill down to is what is within our circle of control. And there we really have to look at the habits that we can do day in, day out consistently, which we know fundamentally will improve our physical and emotional health. And if we can actually take a framework by which we integrate these habits in ways that feel authentic to us and feel doable, and we lose that tendency to feel like everything's got to be perfect. You know, the diet industry will constantly tell us that we're never enough, that we're never doing it right, that there's always something else we can be doing. And actually, if we just take a moment to come back to our bodies, to really think about what's working for us and take that step-by-step approach, we can actually make really good progress rather than starting and failing and starting and failing. And of course, the beginning of the year, we've got a fresh approach, but sometimes we've, by the end of January, already feeling that we've got left behind. So when we think about nutrition, it's such an emotive subject, isn't it? And how do we achieve that right balance? What do we even mean by that? There's no one definition really of a healthy, balanced diet. So it has to be a combination of factors. And the place that I always start with people is my first habit, and I've called it be kind, because self-compassion, our ability to get curious and compassionate with ourselves, is really that gateway to change. If we judge everything we do, we just box ourselves in. And of course, the diet industry forces us to be very judgy of ourselves. And actually, we want to dial down that inner critic, really ramp up the self-compassion, because that's what leads us to making sustainable change. Leading on from that, the second really powerful habit that you can do at this phase of your life is to tune in. That mind-body connection is so important, and there are so many things in modern life that distract us from being able to recognise our hunger and fullness cues. This might be things like food rules that we've picked up from a really young age. You can't possibly be hungry. That must mean you're full. You can't eat that. That's really bad. That's really naughty if you've done that. All these kind of phrases that we find around food are really unhelpful because they start us on a path to distrusting the body signals. And as we heard from Philippa, knowing you're normal, actually knowing what these signals mean for you in your body is really important. So tuning in, really listening to when you're hungry, when you're full, and therefore when you're eating that isn't related to physical hunger, that involves another approach. Third habit is to have nourished mornings. What you do before 12 o'clock in the morning will have a direct impact on what you do after 12 o'clock in the afternoon. And that classic floodgate analogy, 5 or 6 o'clock in the afternoon, when you're in the fridge and you can't remember how you got there. We have to really think about nourishing our mornings. That doesn't mean that you have to sit down and have breakfast the minute you get up if you're not a breakfast person. But I do encourage you to calm your nervous system, to take some deep breaths, to find just a fraction of time for you in amongst all of the other priorities that you have. Because if you can fuel yourself in the morning, you will eat better in the evening. And in middle age, we are not as capable, biologically capable of processing glucose later on in the evening as we were when we were younger. So we have to front load our day and really think about nourishing our mornings. Habit 4 is about fuel confidence, and what I mean by this is getting comfortable with carbohydrate. There's a lot of contradiction around carbs, and I've only probably got 1 minute left, but all I will say is that they are a very helpful food group. They protect your heart, they protect your cognitive function, and they also enable your gut health to thrive as well. And to have a happy relationship with carbohydrate, we have to get comfortable with how much of it we need, and that's going to vary day to day depending on our activities, remembering that our cognitive function is taking up a lot of glucose. So how we function, even though we're sat down, we still require a lot of fuel, and we have to get confident with how we manage that. Our carbohydrate confidence leads us then into using protein appropriately. So we lose lean muscle mass as we go through the menopause. It means that protein becomes even more important, but we want that protein to be used to protect and build our muscle mass. It's also really important for our bone health as well. So if we're getting funny with carbohydrates, if we're restricting them, protein will not be used to build and repair. It will simply be used as a fuel. So once we've got our handle on our carbs, we can then think about the types of proteins that we eat. Plant-based proteins will give you an easier menopause. Generally, you have less symptoms if you eat more plant-based proteins. And we do know that a range of protein will really help to bring that strength to our muscles alongside physical activity, which you'll hear about from Jane. Emotional fitness is about really regulating and not being afraid of our emotions. Our emotions are data. Often we eat in response to emotions and then we give ourselves a hard time. So hence the importance of habit number 1. And we have to think about ways in which we regulate our emotions that don't rely on food. And that leads me to habit 7, which is all about hunting for joy. There is something about the diet and wellness industry that teaches us that we are not allowed to be happy or reward ourselves unless we've been good. We are not allowed to be happy unless we've achieved that weight loss. And actually, we need to turn that on its head. You are allowed to seek out the joy now. People that do that have greater resilience, better eating habits, everything feels more grounded and more calm. We're allowed to eat for all sorts of emotional reasons, but sometimes it's our go-to when actually the body is asking for something else in that self-care toolkit that is so important to us as we go through midlife. I hope that's been helpful, and we can get into it in more detail as we chat later on.
Lovely. Thank you very much indeed, Laura. And now over to Jane. And I think Jane is going to make us have a demo, or going to introduce us to a demo, but I mustn't take the thunder away from her. Off you go.
Well, I hopefully will be able to get us doing a little bit of movement, because one of the things that I want to really express to everyone is the fact that we have this musculoskeletal system and it is meant to move, and our muscles are designed to move. And I think certainly, and we've heard from Laura there, how the diet and fitness industry does get hijacked and seen as something which is for another purpose, which is very much tied into body image. But actually, movement is so much more than that. And from a women's health perspective, there are so many important reasons why women specifically need to move. And we are different to men in the reasons for that and why we need to do that. And it starts from a very young age. There is this amazing window of opportunity when we're in our teenage years to do things like load our bones, to improve our bone health when our bones are actually growing. And in terms of our adolescence, things change in our bodies. Our bone health changes, our musculoskeletal system, all of these things are developing and growing. And then we get to a point where things start to slow down. And that's where looking after our bodies is so important, because whilst we're not always thinking when we're in our teens and our 20s and our 30s about our life when we're older, we really should be thinking, because what we do in every decade contributes to going forward. Having said that, we also can, at any age, start moving and start moving more. There are all sorts of reasons to move. From a reproductive health perspective, from a fertility perspective, from a pregnancy, postnatal, through perimenopause and menopause, there are individual reasons to move. When you are having babies, if you're going to choose to have babies, there are things you can do to help you with your fertility in terms of your movement and your general health, which will also then help you through your pregnancy. One of the muscle areas that gets affected, and I know Nadia's going to be talking about this as well, is our core area. The area of our torso will be the most affected during pregnancy. So the more you can do to strengthen that area before and during and after is going to really, really help you. A really important part of that is our pelvic floor. And I cannot say too much about how important it is for us to be aware of our pelvic floor at any age, because we can have pelvic floor problems. It's not just for women who have had babies. We can have pelvic floor problems. Children can have pelvic floor issues. So understanding and knowing about our pelvic floor is really, really important. And yes, exercise really can help. It doesn't have to be complicated. It can be really, really simple. We also need to be thinking about our cardiovascular health. And the simplest way to do that is to think of walking. Walking is probably the most effective way to start thinking about your cardiovascular health. And if you start getting into the habit of moving from a walking perspective, you make it a part of your life, whether it's just as simply to do something as walking to work, make it a part of your life that's traveling, or something you do with friends, or whether it's something you do just that's a practical aspect, make it a part of your life, because walking leads to other things. And you probably didn't know this, but when you are walking, you are working your pelvic floor. When you are walking, you are working your core muscles because you are moving. And I'm going to take this back now, because I'm going to get us all to do a little bit of movement, because I want us to also think about the importance of strength. And I'm going to just run through to you why strength is so important. We've talked to you about loading your bones and the importance of loading your bones. When you're walking and we're working against gravity, gravity is always overriding. In order for us to develop our bones and our muscles and to keep them healthy throughout life, we really need some resistance. Gravity is a form of resistance. So when you are walking, you're moving, you're working against gravity, and you're doing something for your lower body. Unfortunately, that doesn't necessarily do anything for your upper body, which is why it's also really important for us to be doing strength training. Strength training is a really important thing for us all to be doing, but it doesn't have to mean going to the gym. There are 7 fundamental movements that we need to do. One I've already described to you, which is walking, could be transferred into running if you feel like doing that, but that's one essential. The next one is to be able to squat and lift. That means getting up from a chair. And that is probably the most important strength move you can do, because you need to be able to get up off a chair for your entire life. And it is life-changing when you can do that when you are of an older age. So squatting is really important. Lunging is really important. That's another fundamental movement. To be able to rotate, and for your spine health, and I know Nadia will emphasize that as well, is really, really important. So rotation is another fundamental move. To be able to push and to be able to pull, these are fundamental movements. And there's one more, which is an unusual one. It's called hinging, hip hinging. But actually, it's the most common movement we do all the time, because we pick things up from the floor, and when we're hinging from our hips rather than from our spine, we're going to save our back health. So these are the fundamental movements. There are just 7. You don't have to do any more than that, and you can simplify your movement down to just those 7 things. And if you start to add load, you start to pick up weights. It doesn't have to be very much. For a lot of us, that will be picking up a child. For some of us, it might be picking up something practical like a spade in the garden. It doesn't matter. You need to start creating a resistance that pulls muscle on tendon, on bone. This is what's going to keep you really, really healthy. And you need to be able to feel that resistance. I'm going to come back just to getting us all moving now. As I said, our muscles are designed to move and we need to move. And then come back to the really important thing about the pelvic floor and why this is so important. The reason why our pelvic floor is so important is because at the various stages of life, as I've already said, is that our pelvic floor will go through a lot of stress at different times of life. One of the things that we tend to not realize is that because of this need for the pelvic floor to move like every other muscle in our body, that staying just still actually is detrimental to the pelvic floor, and it can deteriorate in health. So as I say, things like walking can help. But what about if you have other issues with your health? Maybe you have incontinence issues. A lot of women suffer from pelvic organ prolapse, particularly after birth, but also in perimenopause and menopause. Again, we can have problems with pelvic organ prolapse, which is when the pressure, the organs of the pelvis push down on the pelvic floor. So I want you to now we'll do this as quickly as I can. I don't know if have I got 1 more minute?
1 more minute.
1 more minute. So I want you to think about the pelvic floor as your diamond. It's a diamond underneath you and it runs. So this is the shape of your pelvic floor and it runs from your pubic bone at the front to your tailbone at the back. When you think of it between those 2 points and you think internally up inside you, I want you to now just give yourself a little bit of a wiggle on your seat that you're sitting on and try and find your sit bones, yeah? And you might need to pull your butt cheeks out the way to find your sit bones, but if you sit on your sit bones, then you'll put yourself into posturally, I hope, Nadia, a better position for you to help feel your pelvic floor. So you just need to be sat on your sit bones. Now think of that area underneath between your pubic bone and your tailbone. That's where your pelvic floor is, but it's internal and it's up inside you. Now the magic thing is that our pelvic floor moves when we breathe, and we're breathing every second of the day, yeah? So we want to actually work with our breath. So if we start with the diaphragm, I want you to take a nice big deep breath in. Feel your diaphragm move. I'm putting my hands onto my diaphragm. You can't quite see my hands, but I've got my hands on my diaphragm. So if you take a breath in, you can feel your diaphragm extend. So when you inhale, the rib cage goes out, the diaphragm extends. As you exhale, the diaphragm comes in. Now your pelvic floor is doing exactly the same thing, and I liken it to 2 jellyfish, one on top of the other. So do that for me again. Inhale, feel the diaphragm extend, your pelvic floor extends, and then as you exhale, they both come up and inside you. Now to help you feel your pelvic floor, I want you to do that one more time, and you're going to think of pulling up from your back passage as if you are stopping a fart from the back. That's the easiest way for me to describe it. And then lifting up from your front as if you were stopping yourself going to the toilet from the front. So we'll do it one more time. So take a nice big deep breath in for me. Inhale, feel the expansion through the rib cage, extend the diaphragm, extend the pelvic floor. And then as you exhale, you're going to stop from your back passage to your front passage and try and pull up inside you and lift and lift and lift and lift and lift. And then that is a pelvic floor contraction. Don't worry if you didn't feel it. Try practicing it and use the analogy of the jellyfish, because visuals often really, really help. And I hope that's given you all a little bit to think about.
Wow. So we've got Know Your Normal, self-checks and screening. We've got 7 habits. We've got 7 movements. And I've been going up and down here on my seat. Now I'm going to move over to Nadia. Nadia, thank you for waiting patiently. And please tell us all about our posture and the impact that our posture has on our gynae health and our pelvic health.
Good afternoon, everyone. So Jane, you've covered so much of what I'm going to talk about, so there'll be a bit of overlap here. But what I wanted to discuss, that research has basically found that posture directly affects your pelvic floor muscles. So let me just grab my little friend here. And very similar to what Jane mentioned. So if we think about the pelvic floor, here we've got the girdle. The pelvic floor muscles go from the pubic bone and attach here onto the coccyx, and then they go side to side. And what they are actually doing is that they hold our pelvic organs. So we're talking the uterus, the bladder, and the bowels. Now, these pelvic floor muscles are also directly working with core muscle groups, and we're talking the diaphragm, which Jane just talked about. We're talking about the spinal muscles and the abdominal muscles. Now, poor posture, a lot of the time, what that can do is it can create muscle imbalances in these muscle groups. And as it does that, it then directly puts pressure into our pelvic floor. I think I'm going to stand up a bit to show you a few bits. So we're going to start with sitting postures. There's a lot of people now working from home or even just sitting watching TV. If you're sitting on a surface that's making you slouch a lot, so you're kind of rounding out the pelvis, what then happens is the tummy muscles are getting a lot weaker, which then puts pressure onto our pelvic floor muscles, which also makes them weaker, which can then lead to the incontinence of the bladder and the bowel. one of my favorite tips for sitting postures, because there's so many of us that are working from home and sitting for long periods through the day. One of my favorite tips is very similar to what Jane mentioned, is to trying to sit on your sitting bones. So those of you that might be in your office right now, I mean, if you get the weird looks, blame it on us. But what you want to really do is pull aside each of your butt cheeks, and you'll feel those knobbly bones, which are your sitting bones. Now, if you're on a very soft surface, you may not feel that, and that might be your cue to actually get something firmer to be sitting on. And when you feel those sitting bones, they naturally make you sit upright, as opposed to if you're sitting onto your bottom. I mean, some people are like, oh, but I squat all day. But no, you may have buns of steel, but sadly, after a while, you will start to slouch. So what we really want to do is make sure that sitting posture is a bit more upright. So that way we're not putting so much pressure onto our pelvic floor muscles. The other thing you really want to think about is breathing. I'm going to stand up a bit. And I find with a lot of us women, if we are out, a day out, or we might take a photo, we might suck in those tiny muscles to make the photograph look great. But those of us that are holding our tummy muscles in for long periods, what it does is it stops the full diaphragm movement. So as you breathe in, rather than as Jane mentioned, going down with the diaphragm as you breathe in and then the diaphragm going back up, what happens is we are shallow breathing. So there's a lot more breathing from the chest. And as we're breathing more from the chest, what then starts to happen is the diaphragm is working to its full potential. And then the pelvic floor muscles basically start to lose tone. They get a bit more lazy. And again, they're not supporting our pelvic organs. So we really want to think about breathing into our stomach, making sure the diaphragm is moving, similar to what Jane talked about earlier, and really taking that breath in. Shallow breathing is something we really want to focus on, because also that can raise the shoulders. So overall, posturally, we're not helping ourselves. Now, standing and seated postures, and we've just talked about the seated. Standing posture is another important one. I'm going to grab the spine again. So if we look at the spine, so this is a bit more neutral. What we find sometimes is people arch their backs a bit more. And there are certain ethnic groups, so we're talking Middle Eastern, Latin, Afro-Caribbean, they may have more of a sway back, but it's about when it gets too far in. And when you have that, that's called a lordosis. I found actually before COVID, there was like a bit of a phenomenon and a bit of a fashion for girls to have a larger bottom. So I'd have patients coming in saying, oh, my back really hurts. And these are young girls, we're talking late 20s, early 30s, complaining of back pain. But as we're doing the consultation, they're also saying, actually, you know what, I've also noticed that I'm leaking a bit more. And with that overarching of the back, what that's done is weakened those muscles. So it's weakened the muscles in the lower back, which is then again putting pressure into the pelvic floor. And as that happens, again, we're going more towards less control of your bowel and bladder. I found with treatment, with osteopathy, and if you're someone who finds that you have more of a sway back, which for some, they may say, actually, no, you know, Nadia, I'm not arching my back. I'm not trying to look like I've got a bigger bottom for fashion reasons. They might be people that are just sitting there, and they're sitting there for long periods. And what that does is it closes up muscles from your hip flexors to your lower back muscles. One of my favorite ones is just stretching out, lying on your back at the end of the day, pulling your knees into your chest. That really helps open out the spinal muscles, but also doing things like pelvic tilts, where you're lying down with your knees bent and lifting your bottom up, holding it, feeling the stretch. So really working with movement is very important. How are we doing with time? I think I've got another minute or so.
Yep, another minute.
Good, okay. So what I wanted to mention in particular, especially for your takeaway, is you really want to keep moving. Posture is something that's constantly changing. Awareness of your posture is so important. Some of my patients will say, but how do I do that? I mean, I know whenever I used to be around my mum as a child, she'd say, shoulders back, sit up. But I don't have anyone saying that to me anymore. In fact, I say that to my daughters. So what I like to say to my patients is, have that as a reminder on your phone. A lot of people have alarms to say, get up and move off that desk. Same way, have that when that alarm goes off, think about how is your posture? How are your hips? Are you slouching? Are your shoulders up to your ears as earrings? So if posture awareness is one of my first, movement, I mean, I love to say motion is lotion. So the more we move, the more our joints get lubricated. So that is really important. Stretching is another one that's super important. If you're a person who is sat at a desk, your ergonomical area, how your desk setup is another one that's very important. And yeah, in general, those are the things I would recommend as takeaways for your posture. I think my time's up.
Lovely. Well, thank you very much. And I want to thank all four of you for being so generous to each other and not going on and on and on. And you've all been very, very good about that. So thank you. So we've got fantastic messages, as I say, the 7 habits and 7 movements and understanding what your normal is. I feel very passionate about that because so often women don't know what's normal and abnormal, and then they suffer things which they don't need to. And then this is really important. And one of the questions that was submitted before, Nadia, was, can posture affect your pelvic health? And I think you've answered that question beautifully. Now, there are quite a few questions in the chat here as well. How often would you recommend someone does the pelvic floor exercises, and how long for at a time to see an improvement or strengthen? So perhaps Jane or Nadia would answer that one for me quickly.
Do you want to go, Nadia, or shall I?
Go for it.
Yeah. So this is an interesting one. So research traditionally has looked at how many pelvic floor contractions you need to do in order to gain strength in your pelvic floor. And a traditional model and older research, and bearing in mind some of this research has been around since the 1950s, which is where the word Kegel comes from, which is a Dr. Kegel who first invented pelvic floor, traditional Kegel pelvic floor exercises, which are the squeeze type exercises. So researchers looked at up to as many as 100 contractions a day gives you results, almost like the more the better. But actually, if it's all about in relation to how much you can load your pelvic floor. Now, I talked to you about the fact that when you're walking, you're working your pelvic floor. When you're squatting, you're working your pelvic floor. All of these movements will work your pelvic floor. But some of us find we can't do those loaded exercises because we may wet ourselves, we may have incontinence issues to the back as well as to the front, or we just find that it puts extra strain, particularly if you have pelvic organ prolapse. So this is where the squeezy exercises become really useful because you can do them in an unloaded way and they can really benefit. I would say, though, that you do want to move on from those. You do want to actually do all those other 7 fundamental movements that I do and be able to progress to them. But if you want somewhere to start, I would recommend doing anything between 6 to 10 repetitions of a lift, but also a lower. I want to also emphasize the fact that I'm going to say how many times you need to do those, but I also want to emphasize that if you can't feel it lift, or if you can't feel it lower, then it's much more complex than that. And that's when you need to go and get some more help. You can go to your GP and you can get a referral to a women's health physiotherapist. There are also specialists like myself and like Nadia who work with people, particularly to help you find out the issues that you have in terms of your pelvic floor health. It's not as simple as just doing the squeezes sometimes. So if you struggle to feel them, you can't do it successfully, you can't feel it lift, you can't feel it lower, then you need to get extra help. But if you can get up to those 6 repetitions, and you can do that up to 3 times a day, go up to as many as 10 repetitions, 6 to 10 repetitions 3 times a day, and that's going to be really useful. And it's something you can do as simply as when you're cleaning your teeth, you can remind yourself to do it. Think of dialing it up as an exercise. So I'll go through it again. You do that lift from the back to the front passage. You lift up and up and up and up and up, and then you try to feel it relax before you do a second repetition. And work with your breath. So you inhale, you work on the exhalation. So as you exhale, you lift up and up and up and up and up, and then you try to feel it lower. Nadia talked about mobility as well. And I think that's really, really important because sometimes we can't feel it move because we're too stiff. And that's where doing stretches also is really fundamental to your pelvic floor health.
Thank you, Jane. There's some questions here about, are there any particular things for pelvic floor health in women who have severe endometriosis? Philippa, have you any experience of this?
So I think that when Bearing in mind, first of all, endometriosis, that women will often wait an awful long time before they have a diagnosis, and that there can be issues related to chronic pelvic pain, as well as very severe periods, etc., etc. But the question was around adhesion. So adhesions are related to scar tissue. For people that don't know, that there is essentially internal bleeding, and instead of that bleeding being able to come out of your vagina as you shed the lining of your womb in a period, it's going into your tummy, into your pelvis somewhere, and it doesn't have anywhere to go, and that causes inflammation, and that inflammation then causes scarring, and bits of tissue then essentially stick together. Now, ideally, we want the organs of the body to sort of slide over each other. And for example, during penetration, during sex, that's something that needs to happen. And when things get stuck down, that's when they cause pain. And that's why, for example, that people with endometriosis might say, oh, it really hurts inside my tummy, inside my pelvis when I try and have sex. And so too, things can get stuck down around the pelvic floor, and pelvic floor tightness can be as much of an issue as pelvic floor being too weak. And I think that what we need to do in these sort of situations as GPs is refer to the women's health physios, who are the specialists in this area, because actually they will do often pelvic floor releasing exercises and massage internally to try and help with that kind of symptom. And just to add, we talked before about knowing you're normal. There are some things which seem to be accepted as normal which aren't. And one of them is that as you get older, you might leak urine. Something being common is not the same as it being normal. And absolutely no woman should have to put up, or anybody should have to put up with leaking of urine. And so if anybody's listening and thinking, well, I'm doing my pelvic floor exercises, now what? Come and see us, because there is a whole gamut of things that we can do to help.
Lovely. Okay, thank you very much. And questions about, can we have a list or an article about the 7 happens and the 7 movements? Well, I'm sure the team could jot them down in the chat for us whilst we're carrying on and talking. And I think that's so important about the normal. So I see lots and lots of women, because I have a special menstrual disorders clinic, who think it's perfectly normal to not be able to go out of the house for 2 days a month. And it's not normal at all. So I'm on a bit of a mission to get every healthcare professional to be asking women about their periods, because as I keep saying to everyone, I don't know anything else that happens to human beings quite so frequently as 12 periods a year for 40 years of your life. So if they're incapacitating you, this is not normal, and we need to do something about it. You're so right, though, about the urinary incontinence as well. And even if you're a household that talks about periods and menopause at the dinner table, I don't suppose many of the older women in your house come in and say, oh, God, you know, I leaked twice today. We just don't discuss it. So let's make that a normal thing to discuss. And I think that's really important. So many people are saying in the chat, what a wonderful session it's been, really, really useful, and are very, very appreciative. How can GPs help with stress incontinence and pelvic floor weakness? Are there any devices and supplements? And one of our audiences has said the Squeezy app is very good, but
yeah.
I hand over to you, Philippa, for a moment, because I think there are some other things that you could recommend.
So the Squeezy app is absolutely brilliant. There are some NHS apps which have really made sort of behavioural change. One of the most famous one is Couch to 5K, but the Squeezy app absolutely does. Your NHS GP will be able to refer you to a women's health physio. They will talk about things like biofeedback, which is where essentially you get some feedback that you're doing it correctly, and some help that you're doing it correctly. But if those aren't enough, then we can refer you in to see a gynecologist. Depending on your general health and other things, there are options including pessaries, so some support that can be given to the pelvic floor, and sometimes surgery is also given. What's also really important now is that your GP looks at other issues which might be worsening your pelvic floor symptoms. Do you have a chronic cough? Do you have asthma that is not well controlled, or COPD? Do you have obesity, and can we get you into bariatric clinic and maybe some treatment some other way? Are we looking at you not just as your pelvic floor and your urethra, but you as a whole person? And as your GP, that's part of my job, is to connect all the dots and all those specialists that you might be seeing to view you as a person. So absolutely don't give up. Come and see us. And I know it's difficult to come and see us. There's not enough enough of us, but please do try.
I think that's a really, really good piece of advice, and so many people are endorsing it in the chat. I can't read them all out, but everyone's very appreciative and saying, what an informative session. I think, ladies, you might have to cope with me asking you to come back and do a second run at it. And so that would be really lovely. So there's somebody here saying, any City of London Corporation staff listening, just a reminder that we have a walking club that is free to join, and some questions about advice with nutrition and supplements for coming off the pill with PCOS to prevent symptoms flaring up. Would anyone like to talk about the nutritional side of that? Laura?
So just before Laura jumps on, I just want to say really, really clearly that if you are taking a supplement or a herbal remedy, the fact that it is natural doesn't mean that it is safe. And please, can you tell any doctor, any pharmacist that you are taking them? They might interact with another medicine that you're on. They might be contraindicated with something, a health condition that you have. So the fact that you can buy it over the counter doesn't automatically mean that it's safe and great for you. And now I'll hand over.
Absolutely. But just before Laura comes in, that's such an important point to make, because I'm often talking to women who say to me, oh, they're taking Chinese herbal medicines. And I say, well, what's in them? They say, well, they're all natural. To which I respond, well, so is digoxin. It comes from Digitalis foxgloves. And so is aspirin. It comes from willow bark. But my goodness, they can cause an awful lot of havoc. So we do need to be very careful. So Laura, going back to the question specifically about coming off the pill to control this lady's PCOS, I'm deducing, and what she needs to think about nutritionally.
Yeah, I mean, just to reiterate, there are a lot of supplements that claim to help in these scenarios, and sometimes they can be a piece of the puzzle, but of course it's such an unregulated industry that we have to be really cautious with what we're taking, and as Philippa said, really important to make sure that it's not contraindicated with your full medical picture. I know, for example, inositol is used a lot to help with insulin resistance, and there is some research behind that supplement, but with PCOS, it's such a complex condition. There's lots of scaremongering around the need to avoid carbohydrates, for example, because it's associated with insulin resistance. And we can see that the PCOS woman has a greater susceptibility to the stress axis because of the way that the reproductive axis and the stress axis, the precursors of those are talking to each other in the pituitary gland, etc. So taking a food first approach and really making sure that you have a harmonious relationship with food, that you're regulating your food intake, that your physical activity is coming from a place of joyful movement and functional movement that Jane talked about, as opposed to getting into this horrible toxic relationship where we're sort of dieting and exercising. We really want to think about eating well and training well, and those two things complementing each other. So it's really difficult to give specific supplement recommendations. I think I would probably be looking at the bigger picture stuff.
That's good point. Good point. Any nutritional advice for improving fertility help with a relative energy deficiency in sport? Now that's a new one to me. So Jane, you're nodding. So do you want to answer that one, or Nadia?
Just from a sports science perspective, so for a relative energy deficiency, and I'll let Laura talk about the nutrition side of it, but often we're looking at here in a cessation of periods, also an issue with bones as well, and often this comes through overtraining, but also not the right nutrition. So it's really, really important that you get your nutrition right, and you also get your rest. When you're training, if you're doing any kind of training, any kind of exercise that is loading, that is resistive, that is going to challenge you, you must look at the other aspects of training, which is rest and nutrition. You cannot do one without the other. If you want to progress, you need to really think about the harmony of those three things together. Your muscles need time to actually grow, and they need to be in a rested state, in a state of recovery, in order for that to happen. You then need the right nutrition to come in order for those muscles to repair and grow. So if you are suffering from that, I would really make sure you get a lot of support, and also less is often more. Just think of it from that perspective. And it's very hard, I know, for someone that's got a real passion for their movement and for their sport to sometimes think of it from that perspective. But it's really important you get support from coaches, from others around you who can really take that approach with you.
Now, I'm just going to ask a couple of questions about periods, because some of the questions that were submitted beforehand about our menstrual cycle, does it impact our food or our calorie consumption? So perhaps that's a question for Laura and or Philippa.
Yeah, there's lots of talk now about syncing with our cycle from a behavioural perspective, so altering our nutrition or exercise around what our cycle is doing. And we can certainly see across different phases of the cycle that the body uses different percentages of fuel. So we're going to either be making use of carbohydrate or fat as our fuel source, and there's slight variations in that across a woman's cycle. But I think when you drill down into how this translates into practical dietary advice, I think we get hung up sometimes on sort of food lists that we need to stick to at certain times, and we really don't want to feel boxed in by our nutrition. So I think, again, having that really healthy balance can go a really long way to helping us, and to be really gentle with ourselves when we're going to notice that we've got cravings for carbohydrate foods, for example. Really trying to be kind and plan ahead and help our bodies to fuel in a really regulated way, so that we don't get these peaks and troughs in our blood glucose levels, which tends to make us more reactive around food, and then perhaps make choices that we later then feel weren't so great for us. Really making the most of anti-inflammatory foods in the diet, particularly around the time of menstruation itself. So lots of oily fish, lots of omega-3s that we get from nuts and seeds, plenty of fruits and vegetables, which can be dried and tinned and frozen. It doesn't all have to be fresh stuff. And really, as I say, trying to find that balance as much as possible with sources of protein, sources of carbohydrate, and sources of fibre. It's what I call my 3-plonk method. That's what needs to go on the plate. Keep it simple. We don't need to get too complicated about our nutrition. It's got to feel easy and doable.
And I also think that in terms of social media is rife at the moment with exercise according to your menstrual cycle, eat according to your menstrual cycle, and telling everybody that they have a hormone imbalance. Hormones are supposed to fluctuate during the menstrual cycle. That is normal. That doesn't mean that you have a problem. And the term hormone imbalance doesn't actually mean very much to me at all, unless you've been diagnosed, for example, with diabetes and you are not making enough insulin. And so often in social media, they use a lot of terms that don't mean very much and cherry pick the data. There isn't a huge amount of data around syncing your exercise to your menstrual cycle in the non-Olympic running athlete. And I don't know about you, but most of us are not Olympians. And I think that it's really important that we don't sort of get bogged down with ideas that you must not do this because you have your period. It all sounds actually really patriarchal and back to the days of you shouldn't go swimming and you shouldn't have a bath. And quite frankly, women often know their bodies, and you can listen to them and do what they tell you.
Yeah, you train for you. You train to how your body feels, and understanding and knowing your body. And the more you understand it, the more you know it, the more you can do that.
But I love your comment about hormonal imbalance, because it drives me bonkers. I mean, I'm a qualified reproductive endocrinologist, and as you say, that's the whole thing about endocrinology. Wonderful thing about women is they have all these extraordinary things going on, and it allows them to have a baby and ovulate every month and all those sorts of extraordinary things. So I think it's really important that. And my other pet hate at the moment is being shown things on TikTok and on Instagram about how it's very bad to use hormonal contraception because you're putting hormones into your body. And surprise, surprise, we've got lots and lots more unplanned pregnancies, and we've got many more women asking for abortions now. So I just think it's so not sensible. So really, really good point. There's a question here that I have to answer before we finish, and I've only got 2 minutes left. What's the panel's view on taking HRT post-menopause, especially in relation with benefits like helping to prevent osteoporosis? Well, I'm going to say first and foremost, yes, I'm a great HRT advocate, because I'm really frightened as someone who's had breast cancer in the past. That doesn't worry me at all. What really worries me is having an accident or someone crashing into me, fracturing my femur or my hip, and then finding that I'm never actually able to get back to being fully mobile again. That's the thing that worries me. So I think HRT is wonderful as long as you don't have any major contraindication. And even if you do have a contraindication, go and see a gynecologist with a special interest in this field, and they'll find something to help you boost your bone strength and probably get you some estrogen in a non-dangerous way. So we're very much nearly up to time. There's lots of people saying how much they've enjoyed it. Oh yes, Julie Duxbury says, me too, couldn't live without my HRT. I'm not even going to try to, I'm not. So thank you so much to all of you, so helpful, so much useful information. And yes, more requests for doing the seminar or this webinar again. I don't know what we'll do. How are we going to sort of not overlap? But I mean, well, I suppose it doesn't matter, does it? We can have regular ones. But thank you to all of you. You've all of my panelists have been absolutely superb and covered so many different things. And thank you to Nadia, to Laura, to Jane and to Philippa for giving up your time and making so many women, hundreds and hundreds of them on this platform, really appreciative, and they're all saying, I've learned so much. It's absolutely wonderful. People say, I'm scribbling notes as you speak. So there we go. I'm going to say goodbye to you now and look out for our next webinar in a month's time. We do one every month at about this time. And I'm going to say goodbye to everybody and thank you, Philippa, Jane, Laura, Nadia, and the wonderful One Wellbeing team for setting us up and catering for us to have this lovely webinar. So thank you and goodbye and enjoy the rest of your week. Bye-bye.